Davis, before we discharge you to a step-down unit, there's some things that I'd like to go over with you regarding your care, a few things that we could improve on once you're outside of the hospital and back to your normal life. Would that be okay with you right now? Are you feeling up to that? Okay, great. So first, I'd just like to go over your activity level. Do you know about how much activity per day you should usually have? I know you mentioned that you do a lot of walking at work, but outside that, just some routine daily physical activity. Okay, that's fine. So we want you to at least have 30 minutes of physical activity daily, like a walk. You and your wife could go walking. Um, just any type of activity that you find interest to, just a way to improve that heart healthy physical activity. Some other things that we need to discuss are your sodium intake. Do you know about how much sodium a day you should consume? Okay, well, it's about 1,500 milligrams a day, and you can find that information on the box or on the back of anything that you are about to eat, on your nutrition label. That's where we can find how much sodium is within the foods that you are consuming. So we want to consume at least a maximum 1,500 milligrams a day. And some of the foods that you could probably try that are low in beans, grains, berries. The foods you want to avoid the most, though, are your bacon fats, your pork salt, olives and pickles. Those really salty foods, and even pretzels. Unsalted pretzels would be fine, but the ones with the salt on them, we want to really watch about. So those are some things that we could consider. And I'll be giving you some pamphlets on all the things that I'm going over. That way you can reference back to them when you're home or when you're out and you're trying to go to the grocery store. You have some things that I'm going to give you here that you can reference back to. Another thing that I want to discuss with you is your medications that we'll be sending you home with. So I have here that you're on lisinopril for your blood pressure, albuterol for your asthma, and we now have placed you on and aspirin, which are anti-coags. Um, they just keep your blood thin since you've had that cardiac cath with the stent placement. So some things I want to go over with you about are lisinopril. I want you to report any swelling in the mouth and lips. That could be a risk for angioedema, which is swelling, and we want you to report any sign of that or a you want to monitor your blood pressure and record it, just to keep an idea of where you're at and if the medication's being effective. That way when you go back to see your provider, you can give him a history of if the medication's been working and how your blood pressure levels have been. The second medication is your albuterol. We want to monitor your heart rate with that. Sometimes the side effect of that is an increased heart rate, and we just want to make sure that you keep that heart rate within normal limits. You can just count it or have your wife count it using your radial pulse in your wrist. You want to count that for 1 full minute. Also, we want to monitor your blood sugar levels with that albuterol. It has a chance of causing an increase in blood sugar level. So just make sure that you're doing your finger sticks at the appropriate times daily when on this medication. And with the Plavix and aspirin, just report any abnormal bleeding or excessive bruising. Those are 2 things that we want to watch out with that. So do you have any questions about anything that I've discussed with you? Did you name 3 of the low sodium foods that I mentioned earlier? Okay, great. It seems that you're getting a real grasp on some of the things that you could modify to, limit your risk of having another blocked artery and just keep that blood pressure low and keep your heart healthy.